ladies and gentlemen, welcome to the first episode of the Healthcare Growth Cycle podcast. It's my pleasure to have on Frank Stadler, the managing director at Kivorex out of Augsburg, Germany. And Frank deals extensively with a lot of AI and data governance, particularly in the healthcare sector. And we just had a conversation recently, Frank, and we're talking a ton about AI governance, how people are using AI within the healthcare space with HIPAA compliancy, the EU AI Act. And so really excited to have you on to talk all things data governance, AI governance in the healthcare space and how we leverage that as a growth driver for organizations.
Yeah, I'm very happy to be here and also very honored to be the first guest on the new format. It's a pleasure to be here.
Appreciate it, Frank. So if you want to start off and just give a little bit of background into your journey into healthcare and data and AI, I think that'd be really useful for the listeners.
Yeah, absolutely. So I started out as a quite regular junior software engineer and had multiple software engineering jobs in different companies, working with different industries. And after a couple of years, I got my first lead position as a team lead. And this was a new thing for me. It was in the medical field, and we were developing software as a medical product. So this was highly regulated, of course, in the EU. And it was also my first involvement with compliance and having to deal with regulations. And actually also the first time I had to deal with the FDA, because we were a supplier for a pharmaceutical company. And of course, they were interested in stuff like GXP and of course FDA compliance. So we also had to deal with those kinds of requirements. That role I fulfilled for several years, and while at that company I switched my role slightly from being just a team lead of software engineering to being more like a data analyst and taking care of reporting and business analytics and business intelligence. And pretty soon as well also dealing with our data science requirements and doing data science models on our patients' data. So that's when I also had to deal with patient data from our insurance companies in Germany and Europe. Ever since I started dealing with data and data science, I was intrigued and opened up a new field for me. And so I reduced my software engineering parts more and more until I basically became a full data scientist. Also with multiple companies, working as a team lead and doing lots of customer projects in different industries as well. And last year, I founded Kivorex as a consultancy, especially for regulation around AI. With the reasoning behind that was the fact that the EU AI Act came around in August last year. And it regulates a high-risk AI pretty much the same as I had already experienced with medical product software. So the requirements and the compliance is pretty much the same. So I felt at home, and that's what I'm doing right now.
Cool. And when you interact with the FDA, are a lot of the healthcare companies that you've been working with, do they interact with the United States? Are they out of Germany? Like, can you talk on that at all?
So in the recent years, I have not had any company that dealt with the FDA directly, or at least not in projects that I was involved with. But as I said, in the past, we had to comply with GXP as well and FDA GAM5 Part 11, something like that. It's been a while. But ever since I focused more on AI, to be honest, with the whole political situation and also the legal side in the last 1 or 2 years, Many companies here in Europe have become very cautious in regards to entering the US market, as contrary to us here, where with the EU AI Act, we have a horizontal regulation that applies to every industry and every company. And in the US, you basically have state-based regulation that's vertical for each industry, and it's very difficult to basically, as a non-US company, to comply with all the possible regulations if
Right.
you're using AI in a healthcare product. So I think it's very difficult.
Yeah. As far as just challenges with growth in healthcare companies, because that's really the central theme of the podcast is healthcare growth cycle.
Yeah.
Can you give us some insight into your company's frameworks for proper AI governance specific to healthcare companies and how you turn those governance assets, frameworks into actual growth drivers for these healthcare companies?
So I think especially with AI and data usage that we have seen in the last couple of years, many companies, and especially medical or pharmaceutical companies, can benefit a lot from leveraging their data and finding use cases in their data that they can enhance with AI or machine learning. So it's crucial to have good data governance frameworks in place, so that you are always aware of what data do you have, what quality does the data have, and who's responsible for the data. And especially also, how can we use this data in a way that's legal and compliant with regulations, both from AI Act perspective, but of course also from GDPR perspective or special healthcare regulations. And of course, governance is essential in this regard, as you most often will have medical products and you have regulatory compliance aspects there as well that basically require you to have governance, that require you to have risk management and quality management systems in place. So
Sure.
actually, I think the most or many healthcare companies are in a pretty good spot in this regard already, especially compared to non-healthcare industry companies, which might not even have quality management systems in place yet. So they have to basically start with zero, while many healthcare companies are already inside the whole compliance aspect and have been for years.
Yeah. With the influx of all these new AI tools, though, especially relating to healthcare, like what have been some hurdles that you've seen with healthcare companies that might have their governance in place, but now want to introduce these AI tools on top of their data? Like what are some common challenges when they go about implementing a new tool?
I think that the biggest challenge is that with all those AI tools, of course, many of them or almost all of them are SaaS offerings. So you have very quick access to them. That's difficult to prohibit as from an IT perspective. And also the technical requirements to use those tools and to use data with those AI tools has become less and less. Basically, right now, your everyday assistant that hasn't programmed anything in her or his life before can easily create AI agents with little or no help from IT. And so this has basically democratized AI access to the whole company, not just your IT specialists. So it's really crucial that companies have good governance processes in place for new tools and new software, and that people have enough knowledge that they are aware of the implications if they use a new tool without knowledge of some central governance agency or person.
Yeah, that's really interesting. And I'm thinking too, so, there's always so much talk about data governance as a enabler, as a growth driver. It's hard to implement, at least in my experience. So that's why we have people like you that put together specific frameworks to help guide companies, because even me just going into companies and talking to them about some of these at a higher level, like maybe to the leadership or board, it's hard to articulate, at least in my experience. I'm just being transparent. It's been very hard to articulate it. So do you have one example where the framework that you implemented enabled the company to make a faster decision to drive some kind of cost savings or profit? I'm just curious.
Yeah, sure. So I have to think about a good example that's also healthcare related. I have several that come to mind that are not directly healthcare related. But I think that the most obvious example that I have that's actually healthcare related is prediction of implants that are to be used for operations, so for surgery. And if you have implants, then it's crucial to have the right ones on stock.
Right.
And the situation, at least here in Germany or in Europe, is like so that the implant manufacturers, they basically provide the implants to the hospitals so that they have inventory on site, but they will only get sold when they are used. So the inventory management is basically in the responsibility of the manufacturer, but they cannot stock everything everywhere, so they are dependent on being informed up ahead what implants are needed. On the other hand, hospitals and clinics, they usually don't plan this too far ahead, or even plan it before the day that the surgery is actually happening.
Wow.
So they might have very short delivery cycles. If, for example, the last implant of a certain size is used up on Monday, and on Tuesday they have the next surgery with the same size, then they need to supply this within the next 12 or 14 hours.
Jeez.
And that requires good data use. And if you have the patient data at hand before that, you could also already predict which size of implant you will need. So that's one use case that we discussed, and we had some companies that tried to basically increase their lead time and their planning of the implants.
Yeah. And did the implementation then involve some kind of predictive model, or like what was the...
In this regard, it was...
data there?
Yeah, and in this regard, this was pretty easy because with implants, you have very clear linear dependencies on size and weight, of course, on the person. So it was more or less pretty straightforward from a prediction side. But the data involved, of course, was the patient data and the operating data and everything. Also the planning of the operations, surgeries, so that you were able to predict this fairly well. Sure. And of course, something that we did not deal with afterwards, but they also had multiple storehouses where they stored the inventory across the country, and of course they would to predict also where is the closest location where I can deliver this from, and how to stock the different parts there.
Wow.
So look, logistics in this regard are of course always something that requires pretty good planning and prediction and planning ahead. Yeah. Also, of course, a different company I was working with, they supported the government with the distribution of the COVID vaccines. So that's also something where a lot of data was used. How many vaccines were used in the previous week, how many were planned for the next week, and how to distribute them, especially if you have limited supply.
Yeah. Wow. Oh, that's fascinating. um, yeah. So I guess to jump to a different topic, and this is more me just being curious. Is there a talk of value-based care in the EU, or is that more of a United States piece of healthcare?
Can you explain slightly what you mean?
Value-based care is in doctors are paid out by insurance companies based on patient outcomes, as opposed to just saying, hey, here's a diagnosis, we're just going to get paid on the procedure that we do, and then not really monitor what the outcome of that is for the patient. So the idea is that doctors are going to be more strategic with what kind of procedures they end up prescribing to patients and performing on patients. So I was just curious, because I know that's such a central talk in the United States, and yeah.
Not that I'm aware of, but of course our healthcare system in the EU, especially Germany, is very different from the US anyhow. So
Sure.
there are pretty strict general basically fees for certain basically treatments or procedures that a doctor or a hospital or nurse can do, and you just cannot charge whatever you want for this. So, for example, giving a shot has a certain fee, and there's like a factor from between 1 to 2.4, I think, where you can vary. So it can be twice or 2.5 as much, but it cannot cost 10 times as much. And those fees are not regulated or set by the insurance companies individually, but rather for all of them. So there's very homogeneous fees for treatments, contrary to the US, where basically it depends on which hospital you are in, on which insurance company you have, and stuff like that.
Sure. Wow. And then on the note of PHI data, like what could you list off like any differences between like HIPAA compliance in the United States versus the EU and the AI Act, and I mean any other kind of healthcare based regulations in the EU? Like, are there differences in what's considered PHI in the United States versus the EU?
Again, not that I'm aware of.
Sure.
Might be special cases for certain information, but in general, I think HIPAA and GDPR are pretty similar in this regard. And also the UAI Act doesn't add on anything new on that because it refers to the GDPR. So basically, AI Act says data security and data privacy is the same as it has been with GDPR, and you're still obliged to comply with that.
Sure. Okay. That's helpful.
But of course, it's very difficult, or it's a very important topic in regards to AI use, even more so than it has been in the past couple of years, because with the large language models being in widespread use, misuse of data, especially personal identifiable data, is pretty widespread. Not just in healthcare, but also in all fields.
All the fields, yeah. I mean, that leads in perfectly to the next question, which if you were to start with a client that's brand new to AI governance in healthcare, like what's the number one piece of advice that you would give them starting out if they're looking to implement AI and maybe don't even have much of a data governance strategy at all? Like what would your approach be?
Ensuring widespread data and AI literacy in basically every part of the company, because you said it before that data governance is very difficult, and it's the same here. And it no matter what processes and no matter what governance system you implement, it all depends on the people and how aware they are and how well they understand the implications of the data use. And so I think having high literacy and high awareness of the implications with your employees is essential and crucial, and it's the most important factor.
Yeah. And how do you host workshops for that? Is that typically okay?
Yeah.
Okay.
So that's
so walk me through that.
Yeah, so that's something we usually start out with, both in AI use and regulatory topics in regards to AI and the AI Act. We usually start out with specialized workshops and trainings, so that people are aware of the basics of AI. What is AI? What can it do? What are risks? And what are also opportunities that come with the use of AI? Things like AI can make mistakes, AI isn't infallible, AI can hallucinate, and you have to double check the work. It's a support tool. It's not the one-size-fits-all hammer for every problem. And also you still have to think critically and validate the results. And that's stuff we train and we try to create competency with the people that are using that, and also security, and of course also curiosity, because it doesn't work if the people are just giving a tool but they aren't curious and are not willing or able to learn. So if you just hand out Copilot licenses to every employee, you're not going to increase productivity. You need to train them, you need to give them examples, and you need to create curiosity, and then you will see benefit.
Have you seen that healthcare is very pro AI, or do you think that healthcare is more one of those traditional industries that struggles to adopt AI, or at least you're met with resistance when you start, delivering these workshops with some stakeholders? Like, what's that been like?
I think it really depends on the company and the area you are working in. So in my experience, big producing companies, for example, Zeiss or some big players like that, they are very pro AI, and they have understood that they can increase the value creation and the return of invest when they use data and AI very well. But of course, they also have the necessary processes and systems in place. Where there's a very negative view on AI and data use, or at least a very high risk awareness, is in treatment. So everything in regards to doctors and hospitals and clinics, they are very hesitant in adopting this because they deal with lots of patient data.
Yeah.
And they are very aware of the fact that it has to stay local and it must not be misused. So they are very hesitant. Insurance companies, I think it's a mixed bag. On the one hand, they of course are also aware of the sensitive nature of the data, but on the other hand, they are a pure virtual business that's driven by data and numbers, and they don't have any physical products or actual work that they do with the patients. So of course data is a big lever for them to increase their revenue, or to create new products, or to create new benefits for their patients that they care for. So of course they have the necessity to use data and AI.
Yeah, oh, absolutely. Not imagine the concern maybe in a hospital system, depending on the business domain, like if it's finance versus a different department. Like, have you seen just different cultural differences across departments in a hospital system in the past? I'm just curious.
I was mostly talking about the medical area now, where they're actually dealing with patients. I would imagine that everything that's not directly related to patients, but rather on the financial side, or just the maintenance topics, staff related topics. It's slightly better, although when talking about staff and people and employees, there's of course again the German security aspect there, and you have your Betriebsräte, where basically the representatives of the employees want to make sure that their employees are not being treated unfairly or supervised too much or spied upon. So yeah, that's one topic.
Yeah, no, it's super interesting. I was just curious because I've kind of noticed that too, even in the medical clients that I've been working with, and I think it's a lot less of a concern for financial data, revenue cycle management data specifically for PHI breaches, as opposed to more operational or patient claim-centric data, of course. Only makes sense.
I mean, the security aspect is one thing. Another problem that I have noticed also with hospitals and everything that basically is working in healthcare directly, they often have very heterogeneous data landscapes and have multiple separate systems, and there's a lot of data silos there. So it's not so easy to basically create a good data lake house to use the data efficiently. Sure. And they of course are very hesitant to build a data lake with their patient data unless it's on-prem.
On-prem, yeah. Okay, now taking it to Kivorex a little bit, and just again on the topic of growth, right? Let's talk about you a little bit more and get out of the healthcare only growth piece and AI governance there. What has your journey been like founding an AI governance, somewhat healthcare centric, a few other industries? Like, what's it been like being a founder in the last couple of years?
So I founded this with a partner, my former CTO, whom I was working with in the healthcare medical product company. So we both have decades of experience in the industry. We are both software engineers, and we have both had leadership positions in the past. So, of course, from that point of view, we bring in a lot of experience. And he has been a managing director for his own company for a couple of years already. So he was sort of in the lead with all the founding aspects. But it's been quite an adventure, and it's almost 1 year now since we founded. And especially in Germany, founding is of course a very democratic act, and requires a lot of documentation and paperwork and everything. But it's really interesting, and I've been on lots of events and talking with lots of people, trying to get networked, of course, and to find new partners and customers, of course.
Yeah. What's been one takeaway in terms of your growth strategy? Like, what would you say, maybe for listeners, like effective lead generation? I'm also just curious because obviously I run Steinert Analytics, so it's always fun to talk with other founders about lead generation tactics for growth.
Yeah, I'm trying to get many. I'm not a big fan of cold calls and cold contacting. So I've been trying to get warm leads and recommendations and networking a lot because that's something that I feel very comfortable with. So business networks and recommendation swapping, stuff like that. That's basically the main driver for growth, and also doing trainings, doing webinars, doing podcasts like this one, and also doing we have some semi-public organizations that are also trying to bring information to the companies, and I also helped there. I did some lectures at university as well, so trying to be a thought leader and trying to be very highly active and visible in order to create, of course, credibility and also establish yourself as a pro in that regard.
Yeah. I love the comment on, referral, word of mouth, like that direct outbound type lead gen strategy, because I've found that that's been by far the most successful in my business as well. And so it's always good to align with other founders on that. I do a lot of inbound myself with LinkedIn, as you know, Frank. And, it's okay, great. Like a lot of the metrics, the reach, the impressions, it's good, but it's more top of funnel vanity than it is like what's actually going to get you your next deal. So, I think we're on the right track with the referrals and word of mouth.
Yeah,
in consulting at least.
I also try to keep it as physical as possible. So trying to meet as many people in person and on actual events and not just online. Not because I'm really that afraid, but I heard a couple of times as a thought project, like what happens if LinkedIn shuts down or you lose your LinkedIn access? Would that be the end of your business? And if you are only networking via LinkedIn, that could very well mean the end of your business. But if you're also connected on events and in person, then this helps a lot.
Yep, totally agree. So what are some big goals that you have before the year's over? Anything you care to share?
I think the biggest single goal I have is finishing my lead auditor certification that I'm currently working on. So I'm working on getting lead auditor for ISO 42001. That's been on my mind.
Yeah, that's got to be quite extensive. So is that a lot of exams, a series of exams? Like what is
it's one big exam, and it's basically prepping for that exam, yeah.
Whew, man, I don't envy you. Yeah, that's intense. Well, cool. Where can people follow you, reach out to you? Like what's just giving you the platform to kind of plug anywhere people can reach you if they want to reach out?
Yeah, I think that the best platform is LinkedIn. Just send me a message or send me a friend request, and I will be happy to get in touch.
Awesome. Well, Frank, thanks so much for coming on to the Healthcare Growth Cycle Episode 1 podcast. So we broke the ice and a lot of the insights on healthcare in the EU and America and the differences. I think it's going to be really valuable for the listeners. So I really, really appreciate it. And to our audience, we will see you guys on the next episode. Thank you.
Thanks.